The answer to today's NCLEX question on nitroglycerin. While ambulating, a patient takes a dose of nitroglycerin spray for angina. Which action does the nurse take first? A. Obtain the patient's blood pressure. B. Interview the patient about the pain. C. Ask the patient to sit down in a chair. D. Obtain an electrocardiogram. What should we be paying attention to? First, know that nitroglycerin can result in a rapid drop in blood pressure, increasing the risk for a fall or syncope. Second, recognize that all of these things need to be done. This is a priority question. Determine which should come first. The answer is C. Ask the patient to sit down in a chair. Nitroglycerin causes vasodilation. The nurse's top priority is patient safety. The nurse first ensures the patient is safe from a syncope-related fall and then obtains vital signs and asks about the chest pain. If ordered, the nurse completes an electrocardiogram after the other interventions have been completed. If this content was helpful, like this video and subscribe to the channel. Share with someone that might find this useful. Happy studying!